Did you want?
Good morning, Senator. I'm Kent Searl. I'm a registered nurse. I serve as the Vice President for Minnesota Nurses Association, and I work in the intensive care unit at Methodist Hospital, St. Louis Park. Been there since 1983. Very active in the association, and I wanted to touch with you a little bit about a bill that Senator Boxer has out right now. And it's 1031. It provides a lot of different things. One of the biggest things I believe that it provides is it sets minimum safe staffing ratios by CMS through transparent panels that would be open to the public. You know, I've negotiated contracts at Methodist with the help of everybody. One of the things that we've been trying to do, we've had staffing problems there at Methodist, just like everywhere else. One of the things that we've done is we've had a panel of nurses and administrators sit down and we discuss what our staffing should be. We come to an agreement. It's a staffing committee. We come to that agreement at the table, and then we come in between agreements, and they just don't adhere to it. It sounded like a great idea. We've tried it for a couple rounds. It's time for the government to get involved and to step in and say, you know what, if we're reimbursing, we want to make sure that this money is going to reimburse the care that's being given, not to build a new parking ramp or anything like that. And we've got to provide for the growth, but we've got to make sure that the care is being given. This bill would also allow us to speak out and advocate for our patients primarily in a professional obligation role. Similar to the way that social workers can advocate for their patients instead of whoever's employing them. That is very key. Nurses don't have that right now. And just went through a lot of ongoing corporate compliance, CMS compliance in services. Screen after screen or page after page of that in-service talked about how I have to make sure that the money is used correctly. But at the bottom it always talked about how I need to be loyal to the corporation. And that's not why I became a nurse. And I'm really concerned. This is a new thing that I've noticed on those educational pieces. And it scares me where the hospitals are going with that. So making sure that we have the ability to speak up for our patients all the time. You know, we remember when the HMOs were talking to the doctors, telling them not to disclose different treatment options. That kind of got settled, but we don't have any protections for nurses right now. So we need to make sure that that happens. So I'm asking you for your support for 1031, Senator Boxer's bill.